Okay, welcome, Dr. Venn-Watson.
Great. Wonderful to be here, Ariel.
Really excited to talk to you. I have been doing a little bit of a deep dive on your work in preparation for this episode, and it's so fascinating. You have such a fascinating background, and I would love for you to tell us about how working with the Navy and working with mammals led you to this incredible discovery that some have said kind of flipped the food pyramid on its head.
So, I'm a veterinary epidemiologist. I was working for the World Health Organization and CDC for a while, helping to set up disease surveillance systems all over the world. And then about 20 years ago, I was invited by the Navy to help continually improve the health and welfare of aging Navy dolphins, which was a completely unexpected opportunity and turn of events, and I thought I would just do that for a couple of years, and ended up being there for almost 20. And while there, the Navy has cared for a population of about 100 bottlenose dolphins for over 60 years. They live in San Diego Bay. They go out into the open ocean every day, and every day they choose to come back. So it's really an amazing population. The Navy takes such good care of them that they live a lot longer than dolphins in the wild. So dolphins in the wild on average live to 20 years. At the Navy, they routinely live 40 to 50 years old. And so what happened with the Navy is they ended up having this growing population of older Navy dolphins. And interestingly, Ariel, some of them had developed aging associated diseases while others did not. And that allowed us to basically look for what small molecules present in the dolphin's diet predicted the healthiest aging dolphins. And so brought us to our conversation here today.
That's astonishing because that's 2x, almost 3x the lifespan in those dolphins. So, can all of that be attributed to this molecule, which we're going to talk about, and other kind of lifestyle factors? Or is it the fact that they aren't being, I don't know if dolphins are preyed upon in the wild or if, there are boat accidents and things like that? What can be attributed to that kind of discrepancy?
When dolphins get sick, they're actually really good at hiding their illnesses until they're really sick. And then they are susceptible to prey and things like sharks. And, the wild, we see Planet Earth and shows like that. And the wild's getting tougher for animals out there. So the Navy's done a really good job at protecting the dolphins against, the threats that are out there naturally. And then added on top of that, figuring out exactly not just one, but we actually identified about 100 small molecules that predicted the healthier aging dolphins. And just among the top of those was C15. So a contributor to longer, healthier lives and a lot more discoveries to come.
How do you even begin to hone in on those molecules?
We did start with kind of the ones that were right at the top. C15 really rose to the top because it was very clearly a nutrient that the dolphins' bodies don't readily make on their own, and that the main source of it comes from the diet. Now, in the dolphin source, the source was certain types of fish. Some dolphins were eating fish that had high C15, while other dolphins were choosing fish that had little to no C15. For us, our primary source of C15 is dairy fat. So C15 took the priority there. From there, we then took C15, moved it into the lab, and we did 8 studies over 3 years to see if C15 wasn't just associated with better health, but if in fact it could be active and beneficial. And at the end of all those studies, what we published in scientific reports in 2020 was that C15 is not just beneficial in the good fatty acid, but it was meeting these rare criteria of being the first essential fatty acid to be discovered in over 90 years since omega 3.
Wow. Can you talk about the process of how you prove that it's not just an association, how you prove that it actually is so beneficial?
The first question you usually ask in science is, how does it work? So if it's going to be beneficial, what is it, what we call the mechanism of action? And so from there, we did a bunch of cell-based studies and really used third parties for all of this because I'm a dolphin veterinarian and not a lab-based scientist. So we were able to use independent third parties to basically submit the molecule and get it tested and screened for a lot of different activities. And what we found using this panel called Biomap, it's basically 12 different diseases in a dish, and it sees what a molecule can do against these diseases. And we found that C15 had 36 significant clinically relevant benefits against 10 out of 12 of the diseases in a dish. It was so remarkable, these findings, that the people who ran the assay called us up and said, this is really rare to see a natural molecule that is this safe be this effective. So it did things like lower inflammation, stopped scarring in relevant tissues. It did a lot of things that we associate with aging and chronic diseases. It helped reduce a lot of those risk factors. So once we had that underway, then we were able to then evaluate, in humans to be able to say, does it have this beneficial effect? At the same time, the epidemiological studies were being done in humans, showing the same thing we found in dolphins, that people with higher C15, lower risk of type 2 diabetes, heart disease, and fatty liver disease. So really the world has been rallying around. So now there are dozens and dozens of studies on C15's benefits far beyond ours.
That's so interesting. Was it just kind of a coincidence that it was being studied on humans at the same time? Or was this first discovered in this setting with the dolphins and then scientists decided to study it in humans as well?
A couple things that happened with C15, because C15 is this odd chain saturated fatty acid that the world has known about since in the 1950s. There were a couple things that helped bring it to light. For us, we kind of got a fast pass because the dolphins' data were so clean and clear. All they eat are fish versus our diets are very complicated. So the same story was coming out in humans, just taking a little bit longer. So they were just right behind us. The other thing is that C15 used to just be considered basically a biomarker of other fatty acids. So it was not actually counted in a lot of studies before the early 2000s. They pulled C15 out of the studies, just assuming it wasn't active. So that just started coming back into the fold. So there are a lot of things happening in the world that it would have been, I hope, inevitable, but a big blinders we had up on C15 is that, it's a saturated fatty acid. And so even though studies were starting to come out, I think a lot of us had blinders up saying, well, that can't really be true because it's a saturated fat.
Can you explain the difference between a saturated fat and an unsaturated fat?
Basically, what determines a saturated versus an unsaturated fat is whether or not that chemical structure has double bonds in it. So you remember the sticks and balls that we would have to put together the structures. If there's a double bond between any two of the carbons, that actually becomes a weak point for a molecule, and that molecule it can bend, but it's also susceptible to getting attacked by oxygen, which then results in lipid peroxidation, oxidative radicals, all these things that are bad for our cells and for us. So a saturated fat has no double bonds, so it's a very stable fatty acid, and an unsaturated fatty acid has a double bond. If it's a polyunsaturated fatty acid, it has multiple double bonds. So hence the difference between the two. We've traditionally seen saturated fats as bad, but it ends up there are two categories of saturated fats. One is an even chain saturated fatty acid like C16, C18, and the others are these odd chain saturated fats like C15, C17. So it ends up the even chain saturated fats continue to be associated with poor health, pro-inflammatory, increased risk of type 2 diabetes, heart disease. And these trace levels of these little odd chain saturated fatty acids, lower risk of type 2 diabetes. So really amazing and anti-inflammatory.
What things that we consume would be categorized under saturated, unsaturated, polyunsaturated?
Absolutely. So saturated fats, we think about, when saturates were seen as all bad saturated fats. That is why we've been told to avoid, since the late 1970s, whole dairy fat, butter, cheese, red meat. Those are the things that contain high levels of all types of saturated fats. And then polyunsaturated fats are like your oils, your omega-3s, omega-6s, and those are your kind of traditional polyunsaturated fatty acids.
It's so interesting though, because I feel like in other places in the world, their diets maybe incorporate more dairy, more cheese, things like that, and they tend to be healthier. That could be a total overgeneralization, but than we are here. So does that have to do with this fat content, or is it, probiotics and things that are in the dairy, or can you speak to that at all?
As we've moved away from drinking and eating whole dairy fat, we've actually taken C15 out of our lives. And we know population-wide, our C15 levels have been declining because of moving away from this. And the hypothesis is that we've accidentally created nutritional C15 deficiencies that in fact are driving these, increased risks of and the rise in type 2 diabetes, heart disease, cancer, especially among younger and younger people. And to your point, Ariel, the communities that still have the whole fat in their diets, that they are seen as, having protection against it. We still have to balance, the dichotomy of there are these even chain pro-inflammatory, even chain saturated fats at much higher levels in dairy fat. So it's really finding that balance of getting the good fats and trying to cancel out the effects of those bad
How
fats.
does somebody go about finding that balance? I mean, is it just everything in moderation or incorporating some of these things and then supplementing as well? What can that look like in practice?
It's a great question. It's one reason why, when I was at the Navy, this is when this discovery was made. And so this is Navy technology and invention. And one of the reasons why we worked with the Navy to help bring a pure C15 supplement to the world, through Fatty15 was for this purpose. So it was the recognition that if you give pure C15, for example, studies have shown that you can get the benefits of improved liver health, decreased glucose, and lowered cholesterol. And those benefits are not as high. In fact, they could be the opposite if it was just dairy fat. That said, I think that, we're going to hopefully we get to the place where we look at our kids and children, it's milk. So it's what every mammal gets from birth. So we probably are going to just need to get whole fat milk for kids who aren't lactose intolerant and can have it back into their lives
Mhm.
and allow them to have it. But maybe we don't need that pro-inflammatory, food for knowing that we're going to live into 100 or longer. And maybe that's not what we have our whole lives. So we kind of fix it by supplementing with the pure C15.
Hmm. Tell us how the supplement version came to be. I mean, was there kind of this aha moment after seeing all of the studies and the data and the not only the associations, but you proved all of these different benefits that it has against fighting disease and all of that.
Right. So we were initially developing pure C15 as a drug, as a pharmaceutical.
Oh.
It was looking so promising, especially in the area of fatty liver disease, which is now affecting 1 in 3 people globally. And it kind of showed up out of nowhere. In the 1980, it was first reported at Mayo Clinic and now present in 1 in 3 people. So one of the hypotheses is that fatty liver disease is a C15 nutritional deficiency syndrome. So understanding that, we were moving forward for this as a potential pharmaceutical to help treat fatty liver disease. And then COVID hit. So, and clinical trials all went to the side. And at the same time, we were discovering that it was meeting the criteria of being an essential fatty acid. And so when all of those things happened, our clinical and science advisors said, listen, enough is enough with the science. You've been working on this, by then it was 8 years on the molecule. And they said, it's time to bring it to the world. And because it's a natural ingredient, maybe the way to increase the accessibility to people isn't through as a pharmaceutical, but as a supplement. And
Hmm.
so we ended up developing it pure. We made it vegan friendly and found a way to be able to bring this pharma grade C15 out as a supplement to be able to make it much more accessible to the masses.
Okay, let's rewind a little bit because myself and maybe some of the listeners are thinking this sounds amazing, but what exactly is the role of an essential fatty acid in our bodies? Like, why is this so important?
Right. Where does the essential come from?
Yeah.
Right. The definition of an essential fatty acid is that it is a nutrient that our bodies must have at certain levels in order to maintain our baseline health. And if we have levels that are too low, we will literally start falling apart. For C15, it's at the cellular level. But our bodies can't make it. So our bodies can make a lot of different types of fatty acids, but it can't make something that's an essential fatty acid. And that's why you have to get certain levels of this nutrient from the diet in order to have those baseline levels. So prior to the discovery of C15, there's one omega-3 and one omega-6 that had met those criteria, and they were both discovered back in 1929 and 1930. So it's been a long time since a nutrient has really met those criteria, and so exciting that the dolphins helped
Yeah.
us discover something that's helping them, but us as well.
Okay. So Let's talk about this in the context of women's health. How is this relevant in something like hormonal health, PCOS, things like that, if you can speak to that?
Right. We've seen the world has seen an increase in things like with metabolic syndrome. That goes alongside with fatty liver disease, as does PCOS. The world has seen an increase of these diseases in all populations, but women especially, and of course, specific to PCOS. And so the underlying driver, a lot of these conditions is insulin resistance. And we're seeing an increase in this. And, a lot of, I don't want to say blame, but a lot of it gets attributed to we have terrible diets and we aren't exercising enough and there are environmental factors. But what's interesting is similar metabolic syndrome was popping up in the dolphins as well. And the predictive protective factor against it. And then what treated it in the dolphins was C15. So the dolphin model, the population kind of takes out a lot of these other factors that we've been talking about. Dolphins don't eat ultra processed foods and they're not overweight. And so there are a lot of things that help clean up at least a component for women. On women's health, some of the most exciting work around C15, in addition, of course, to metabolic syndrome and associated PCOS, has to do with really women's fertility and women's health and the health of our babies from going from the ovary on up. That now numerous studies have shown that the more C15 a woman has in her body, the healthier her baby grows in her, and then as well as grows after the baby's born. So better body growth, better health circumference with regard to fertility, that the embryo divides at a healthier rate if it's in a milieu that has higher C15 in it that comes from mom. So we're learning with regard to the essentiality of C15 that when you talk about essential to life, it's now appearing very early and translating all the way through, as we get older.
Yeah. So I was going to ask, who is this appropriate for? Can everybody take it? Can pregnant women, to your point, take it? Can older people, younger people? Is this something that everybody should be including into their lifestyle?
It should be seen as a vitamin. So kind of when we think about essential fatty acids, a way to think about it's the same definition as a vitamin. So something that we all need. And we'll tell you that those that are most enthusiastic about it are in their 30s plus, because C15, the way it has many different functions, but one of the core functions is it goes into our cell membrane, which is made out of lipids. And it's a very sturdy fatty acid, right? Because no double bond. And it literally just helps make our cell membranes and our cells more resilient and more resistant to breakdown. And so those of us who are older, we hit 30 and up, we start breaking down.
The wheels start falling off.
Yeah, exactly. So our health starts to decline. Unfortunately, we start falling apart at the 30s, in our 30s. And so C15 helps to stabilize those cell membranes. It helps with cellular signaling with regard to, metabolism, inflammation. We're learning more about hormones, so it's still early in that stage. So everybody needs it. But the people who feel the benefits sooner are those that are a little bit broken. For me, I've went through, menopause and had poor, and so your aging rate accelerates once you hit menopause. And so sleep is poor, hair was getting thin and fragile and falling out, and my skin was just getting super dry. And when I started taking Fatty 15, all of those things resolved, even joint pain. And so it first felt, a little unbelievable, to be honest. It's like, well, there's got to be a placebo effect here. But we now understand it really is helping to shore up and youthify, right, our cells to get them back to where they were. And if it's doing that, we're made out of cells, and it helps. And now we know there are a lot of other folks who are feeling that same benefits. And now the science there is behind it.
Well, I was telling you before we started recording that I've been talking about how I want baby dolphin skin. And you were like, oh, well, I have just the thing for you.
Right. I mean, it's the whole, this whole endeavor and accidental discovery really of C15, unexpected discovery, we've been pursuing for a decade the benefits to our metabolism, to our immunity, to healthy aging. And we weren't really expecting, we weren't going after the hair and skin component, but it all makes sense. If we have nutritional deficiency, one of the first things that gets seen is hair and skin, and aging creates a nutritional deficiency in C15 and or through our diet. So I'm being able to get that back in. It's like, okay, now I'm getting why the dolphins have super nice skin.
Yeah. How does it differ? I mean, I know that so many people take things like omegas for, inflammation, brain health, hormonal health, all of that. So how is this different from like an omega-3 or an omega-6?
Right. So there's two ways to answer, two answers for that. The first is it's complementary. And that is because even though omega-3 and omega-6 and C15 are all meet the criteria of essential fatty acids, the omegas and C15 are kind of like the yin and yang. And that gets to this whole saturated, unsaturated fatty acid
Hmm.
structure, right? So while the omegas are good at making our cells flexible, the C15 is good at making our cells stable and resilient. So they work together in our cell membranes to help make our cells healthy. That being said, as we get older, our cells become more fragile. And so we need more of those bricks in our in our cell membrane to help kind of fight off the fragility part. And with regard to benefits, we had the same question. So once we discovered that C15 was meeting the criteria of an essential fatty acid, we then actually tested it head to head against pure EPA, which is an omega-3, which has the most science-backed benefits specific to heart health. So we
Hmm.
were working around that. And we used that same biomass profile. And what we showed was that C15 had all the same cellular benefits, anti-inflammatory, anti-fibrotic, than EPA, pure EPA, but it had 3 times more benefits. So on that front, specific to cellular health, C15 outperformed even pure omega-3, but understanding there's complementary benefits. And we do recommend people get their omegas ideally from fish, and it's because this instability of polyunsaturated fatty acids, it's hard to put an omega-3 in a supplement and have it stay stable because again it's an oil, oxygen hits it and it goes through lipid peroxidation. And we now know, multiple studies have shown that half of the omega-3 bottles that you take off your average grocery store shelf, half of those have lipid peroxidation levels that are above voluntary international safety standards. And it's not the producers or the company's fault. It's a super susceptible fatty acid, and it's just really hard to keep it. So with regard to that, we recommend the trying to get as much as you can from fish.
Does that essentially mean that it's rancid?
Yeah,
The
yeah.
peroxide?
That's another way. Exactly. And
Okay.
if there's a scent tab in there, in the bottle, things like that, it's kind of tipping you off. Or if it tastes fishy, that rancidity is what makes the fish taste stronger. If it smells bad when you open it, like those are all things exactly like you're saying that it's you know it, and the way we think about it and define it is rancidity.
I know that Fatty15 is vegan friendly, and we do have so many supplements. And I wonder if, people can get by, eating low fat still and being vegan and just supplementing with all the rest. But it sounds like it's kind of a mix of the two.
It's a mix of the two. For C15, you really can, because it's a stable fatty acid. It's not an oil, it's this pure white powder. So, with regard to supplementation, you can get the C15 that you need, especially if you're vegan and you're not drinking cow's milk, because there's no C15 in plant-based milks, for example, that you can get it. And there's actually tests available to measure C15, so you can actually see if you're low, and then be able to use C15 supplementation and use those tests to guide the amount of C15 you can and should take, in addition to hopefully more than half of our customers feel better within 2 weeks. So the hope is that you feel it, and then the second is that you see those results when you go to the doctors, get blood work, see improvement in your blood work, but then also to just be able to measure where your C15 levels are.
Do you recommend everybody test before they take a supplement, or is it safe to take it without knowing what your levels are?
So it's a good question. It's safe to take regardless of what your levels are. So there have not been any identified. You have too high levels. So it's safe to take. The test is like a bonus if you, for example, were taking it and if you weren't feeling the benefits, then that would be probably a good next step to say, well, let me see where my C15 levels are. And maybe I need to do some front loading to kind of get to that. But we recommend people start with just one capsule a day and give themselves 3 to 6 months at that to see the benefits before having to spend any more money on more pills or tests.
So you mentioned how people feel. And I know that there have been reports of lowered anxiety, deeper sleep. What are some of the other benefits that people feel aside from how they look and, their overall health? And what is the mechanism of that? How does it affect something like anxiety and sleep?
Right. Because the dolphins didn't tell us this. They didn't tell us like, I got a good night's sleep last night. That ended up being a delight and surprise of Fatty15 once it started really getting out to sizable populations. And I felt it myself. And it was first we're like, gosh, is this a placebo effect? And then we realized, no, this is real. The study on C15 has continued. We've continued to do it in the world as well. And what we found is actually we went back to the dolphins. And remember, we said we looked at all these like different molecules and we found 100. We were looking at molecules that were related to C15 in that list. And there was one right next to it. And it was called pentadenyl carnitine. We'll just call it PDC. And it ends up that our bodies use C15 to make this molecule called PDC. And when we then screened that molecule, right, went back and did that same process and we screened how does PDC have any interesting activities, that's when we found it was the second ever discovered full acting endocannabinoid, which means it's activating CB1 and CB2 receptors throughout our body and brain, which cannabis activates, and it helps with sleep and mood. And all of a sudden, everything started really falling into place with regard to feeling better. And then those, receptors, even though they're called cannabinoid receptors, they aren't there for us to have found, marijuana. They're for a reason. They're the ultimate body balancers. And now we're coming to understand those receptors are there probably in part for this molecule. So we were meant to get C15 in our diet so we get the benefits of C15, but also so we could have this metabolite that then helps with the feeling good part, which is amazing.
Yeah, it's so crazy. It's just astonishing how complicated nature is. What are some other things, or is there something that you can think of that was surprising that you learned, whether it was around C15 or just from studying dolphins themselves? I mean, it has to be so fascinating.
Yeah, incredible. I mean, with regard to the dolphins, what was fascinating was, again, because this is a unique older population allowed to get old, that they were developing diseases similar to us, including fatty liver disease, including the full suite of changes in the brain consistent with Alzheimer's. And, this is a population that's naturally allowed to get older, and these diseases, just like us, happen naturally over decades. So the value of that for us to be able to go in, and how wonderfully my primary job is to help improve dolphins' health, right? And wonderfully how we're able to make these discoveries that then translate to our health too. So that's on the dolphin side. The C15 side, I have to say that the breadth of importance of the molecule that's now, like I said, not coming, science is still coming from us, but how much, say every 3 weeks, there's a new paper, a peer-reviewed paper being published on different benefits of C15 from others throughout the world, has been a true gift to be part of this whole movement.
Yeah, that's incredible. It must just be so gratifying, both the working with animals and then also this discovery and, the implications of that. It's incredible.
Well, things I'm not allowed to complain about.
Yeah.
So yes, it's been great. And it's just, following, really for us, it's just following the science and letting the science lead. And then, being able to help encourage others to be able to do that as well.
Amazing. Well, tell everybody where they can get Fatty15 and find your work.
Absolutely. So you can get Fatty15 at fatty15.com, and you can read and learn all about the supplement there. And then you can read and learn about all of the science around C15 at discoverc15.com. And that's where we put all the most recent publications from all over the world over on that site. So that can also help you fall asleep.
Thank you so much for coming on.
It was wonderful being. Thank you. Thank you
Thank
for
you.
having
Of
me.
course.